What's the best treatment for my uneven lips?
Lip augmentation is a very popular procedure in our practice, and we have many patients come to us with concerns regarding everything from genetically and age-related thin lips to uneven or asymmetric lips. Lip asymmetry or unevenness is a common concern amongst patients. For some, it's simply something they were born with that they become increasingly noticeable as they get older. In other situations, the asymmetry may have been caused by a lip augmentation procedure where too much volume was placed into the lip, resulting in an uneven outcome. There are some situations where so-called permanent solutions, such as a lip implant, fat graft, or liquid silicone injection, resulted in asymmetry amongst other issues. I'll discuss how I look at lips and provide my patients an understanding of my approach to maximize their appearance and symmetry. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people deal with facial concerns so they can look their best is the basis of essentially every consultation. Lip enhancement is a common procedure which we do every day. Lips are an important area of focus on the face which requires artistry in determining where and how much volume to place and to apply technique to avoid lumps and bruises. People undergo lip augmentation for various reasons, whether it's to correct natural asymmetry or unevenness, or a desire to further accentuate certain areas which already look good to look even better. Looking at lips and determining what to do and how to do it requires a high level of understanding of lip anatomy. Areas I consider during evaluation include the volume in the upper lip, volume in the lower lip, the vermilion border, the corners of the lips, the curve that shapes the center of the upper lip called Cupid's bow, part of the upper lip called the G and K points, the philtrum. You can see that there are many areas where fillers can be placed. My approach to lip augmentation is to enhance lip volume in such a way that it still looks natural and appropriate to a person's face. The first thing many of our patients say is that they want to avoid the appearance of duck lips, which then is followed by listing celebrities who they feel have this particular attribute. I explained that analyzing the proportions of the face and recognizing how the size of the lips balance with the rest of the face is critical. According to psychological studies, we look at faces with an area of focus that can be defined by an inverted triangle starting at the eyes and going downwards towards the chin. This area includes the lips. This means that the lip appearance has a significant impact in how someone perceives your age and attractiveness. Speaking of balance, I apply principles based on the golden ratio. The golden ratio is a proportion of beauty and balance found throughout nature. The golden ratio refers to the ideal proportional ratio of 1 to 1.6. For lips, that works out to 1/3 lip volume of the upper lip and 2/3 of the volume at the lower lips. Applying the golden ratio helps create proportions that we naturally see as attractive. In my practice, my patients find lip augmentation to be a straightforward procedure. It helps to have a sense of artistry and have a lot of experience when using fillers. In a way, the filler is the material being applied like a sculptor, with a vision of what the lips should look like and knowing how to work with the filler to achieve this result. In our practice, we use softer fillers for the lips, such as Restylane L, Restylane Silk, Juvederm Ultra, and Juvederm Volbella. The improvement seen with these fillers that we use lasts about 6 to 12 months. When patients come to us with the desire to correct natural lip asymmetry, where one side of the lip looks thinner or less full than the other, the logical approach is to place filler into the part of the lip that lacks volume. This is a dynamic process, since as I see improvements occurring, I notice how other areas can be enhanced to create an ideal end result. Technique is critical when it comes to having precise control of volume placement. The lips are sensitive, and it's important to minimize trauma to minimize swelling. I select specific blunt cannulas which cause much less trauma than needles. In addition, the strategic use of cannulas minimizes the amount of pokes needed to actually deliver the filler. My patients are often pleasantly surprised by how good their lips look immediately. I usually see my patients 2 weeks after the procedure to see how the material has settled out, and at this time see if enhancement would be indicated. I find it's always better to start conservatively and add more later if needed. Sometimes people come to us with concerns of uneven volume or bumps on their lips after having lip augmentation elsewhere. This often occurs when filler is placed superficially in the lip. In these situations, if the shape has not improved with time and massage, I dissolve the filler with the enzyme hyaluronidase. Sometimes uneven lips may not be due to just lip volume, but because of the dynamics caused by the relationships of the muscles around the mouth, as well as natural bone structure asymmetry. One side of the mouth may be higher than the other, or the mouth just appears to be frowning. In such cases, we can use a different injectable treatment plan, commonly called a Botox lip lift. I use a neurotoxin such as Botox, Dysport, or Xeomin to relax a muscle called the depressor anguli oris, which results in a lift of the outer corners of the mouth. The same concept can be applied to relax one side of the mouth for a more even, symmetric smile. The effects of Botox and other neurotoxins can last about 3 to 6 months. As far as needing to look good as quickly as possible, with proper technique, we can get patients to look pretty good right after the procedure. However, even with the right technique, swelling from lip filler can last about a week before the appearance is stable, so I'll allow at least a week before a big event. With the Botox lip lift, the effect of the neurotoxin may take about 3 days to take effect, but peak effects are seen about 2 weeks after treatment. Whether Botox or lip fillers are used, I regularly see patients in follow-up after 2 weeks to assess their results and see if enhancement may be needed. Having thin, uneven, or asymmetric lips can be something you'd like to improve but have been afraid of looking unnatural or overdone. As you've seen, proper analysis with strategically placed fillers and neurotoxin using minimally traumatic, quick recovery techniques can give you the natural-looking lip enhancements that's right for you. I hope you found this information helpful, and thank you for your question.